So I have been a NICU nurse for 10 years and then recently have moved on. I'm a nurse practitioner now in the cardiac care unit at CHOP. For me, like getting intubated patients out of bed, like we do it all the time in the NICU, and it would just seem like this, like what in the CICU?
Mhm.
So it's interesting how you have to start small when you're making such a big cultural change in a unit and then scale that up. And when you're holding, are you like skin to skin? What does that look like when they're holding in the CICU?
So it depends on what phase they're in. Some of our parents are not as comfortable as NICU parents doing the skin to skin. I think this is our next thing that I'm really passionate about is increasing the actual skin to skin time we have. Probably about 60% of the time, they are just over clothing or a blanket on the parent or caregiver. I would say most of the time they're more the cradle position if they're intubated for us because our babies aren't as small as NICU babies oftentimes. And so a lot of times NICU babies, you can manipulate a little bit more. And so we may have a 12-pound baby and it's a little bit harder to do them like head up, chest to chest if they're intubated, but oftentimes they'll be more in the cradle position.